Good morning, everyone. Now, what we are going to do is we are going to again learn the next procedure, that is draping a patient for a cystoscopy or a perineal surgery. So, we already placed the patient in a lithotomy position, so on two poles. Okay. Now, we are just going to clean with. So, the only thing is when you are cleaning the genital area where it is the mucous membrane are there, never use alcohol or povidone. It's use some simple antiseptic is fine. Okay. So, I just clean the area and discard it. So, we are going to start, and first I am just going to place a bottom drape just to have a initial sterile field, and I am ensuring that my hands are not touching anywhere. And now what I will do is the leggings. I got two leggings, so I am going to cover each one. So, I got the opening here, and usually there will be a slit will be there, so that slit has to go downward. Okay, I'm just looking for the slit. Okay, this part. So now safe. And even though now the good thing is, even though you wanted to adjust the leg towards one side, you can easily adjust it according to your convenience, and you can tighten it because I have draped it. It is completely straight. Now I got the whole towel, which I am going to place it. Okay. Now spreading the whole towel on both sides. Okay, there are certain times if it is cystoscopy and all where more fluids are there, you can even keep a collection chamber also here down. And the final one, I am just going to drape it on the side. So I need a help. Yes. That's fine. Thank you. So this is the draping for cystoscopy, ureteroscopy, or even you wanted to do some anal surgery or TURP. All these procedures, or insertion of stent into the ureter or removal of stent, then TURBT, all those, that means transurethral resection of bladder tumor or transurethral resection of prostate gland. So all these things you can do it. Okay. So even for DNC procedure, you can do it, and even some surgeries in the anal area, that also you can go for the same type of draping. Okay. And there is one more thing that there are certain places they do is for cholecystectomy, especially if they go for laparoscopic cholecystectomy, because the surgeon preferably they wanted to be stand between the legs close to this area. But even though the incision or the laparoscopy unit, everything will be connected into the abdominal area, but the surgeon prefer this because they'll get more hands-on feel, because gallbladder is little above, not on this area. It will be slightly upward near to the liver. So the access, vision, everything will be good from the between the legs. So they also do it lithotomy position. But certain surgeons, they just go to the side and do it. So before the surgery, you have to ensure which type of draping, which type of position, very mandatory. According to that only, you have to prepare for the draping.